Hello and thank you for accessing the demonstration of EpiCenter, the new online system for public health agencies from Health Monitoring Systems. I'm Steve DeFrancesco, Chief Information Officer of Health Monitoring Systems, and I'll be your host on this quick tour of EpiCenter. We're excited to be offering EpiCenter to public health agencies. We believe it's going to be a real catalyst for epidemiologists and others in public health to operate more effectively and to dramatically improve how you track and manage public health threats. My mission with this demonstration is to tell you about some of the new features and functionalities of EpiCenter, give you a few examples of how EpiCenter can be integrated into your daily workflow, and then briefly explain why we think this platform is indeed a real breakthrough. But first, let me give you some background on our company and our view of biosurveillance.
Health Monitoring Systems is a young company, but we already have a customer base that spans the United States, from New Jersey to California. We serve public health agencies at all levels of government, as well as healthcare providers. We provide services that help focus healthcare resources on existing and emerging threats to community health. We do this through a software-as-a-service model, meaning that we host software for our clients to then use across the web. EpiCenter is one of these services. So why is EpiCenter such a big deal? Well, we think it's going to help usher in a new era for biosurveillance that moves beyond traditional syndromic surveillance to what we're calling community health surveillance. The community health surveillance approach combines the basic classification and early event detection functionality of classic syndromic systems with sophisticated analysis techniques, workflow management, and a consolidated view of diverse, yet related data sources. Taking this approach with the design of EpiCenter resulted in a comprehensive system that will dramatically improve the daily activities of hospital and public health personnel. Okay, now that I've set the expectation that EpiCenter is going to dramatically improve your daily activities, it's time to walk through the system so you can see it for yourself. I do want to note that data used in this demonstration is not actual. We're using information that is realistic, but not real. Now, there are several innovations within EpiCenter that are particularly important, and I'll just quickly list them now so that you can watch for them as we go through the system. First, we have new classification methods that are more in tune with the user's needs. Second, we drastically improve data visualization and interpretation through advanced mapping. Third, we've incorporated new investigation management tools. And fourth, we provide the ability to track a patient's progress from registration through discharge. So let's start with the types of data that we're collecting and the classification methods that we're using. The data we're collecting and analyzing for our clients includes hospital emergency department registrations, ICD-9 codes, and patient discharge records, all in real time. We are also working with electronic lab reports, case management files, and data external to health systems, such as veterinary lab results, air and water quality, and poison control center data. With EpiCenter, we're introducing new classifiers, as you can see here, that more fully utilize traditional emergency department data, as well as the new data sources that we are incorporating. Where classic surveillance systems are typically limited to classifications based on syndromes, EpiCenter provides a nearly limitless amount of flexibility in organizing these data. Some examples of new classification methods that we've included in EpiCenter are symptoms, which provides a more granular and specific classification method than broad syndromes, traumatic injuries, which allows users to track information from incidents such as car accidents, child abuse, and gunshot wounds, and animal injuries, which groups information that is reportable in some areas, such as animal bites and rabies. Providing the ability to easily customize and add classifiers is part of our push to help you meet a broader array of needs, from daily surveillance to mandated reporting. So how do users view and work with these data? The answer is through the advanced mapping and charting tools that we've incorporated in EpiCenter. As an example, let's choose the infectious disease symptom classifier, diarrhea and vomiting, and ages 18 and under. Now this is where it gets really interesting. Instead of simply displaying counts of the selected data, we allow the user to select an analysis method and then display the results of that analysis on the map. I'll choose the Poisson visit frequency. The resulting display shows the probability of an event based on the data and algorithm that we have selected, where the darker gradient represents a higher likelihood of an event. This functionality is very useful in determining if a trend or event is isolated to your community or more widespread. When looking at surrounding communities, it will also help you determine if there is a potential health event moving into your area, analogous to a local news station showing you a radar image of weather moving into your region. Another tool that EpiCenter provides for data view and comparison is the chart page. Using the same criteria that we entered in the maps page, we can now see trends for this group and then display other groups next to it for comparison purposes. Earlier I talked about combining early event detection with new classification and analysis methods, so now I'm going to show you how we are doing this. I said before, we collect data from healthcare providers, testing labs, etc. 24/7 and process these data through sophisticated analytics. The analysis pinpoints unusual patterns in these data, what we call anomalies, and automatically sends notifications, such as this one, out to the respective end users, alerting them of a possible event. This automated detection and notification process is your watchdog, keeping an eye out for potential intruders and alerting you of the situation. It's meant to assist you with, not replace, your normal activities. Users can access anomaly information through this screen in EpiCenter. You'll note the pins on the map. Each represents an anomaly in that particular region and has a corresponding description in the column on the left. Clicking on any of these anomalies in the column will take you to the details about that particular event. As you can see, EpiCenter provides several options for viewing these details, from a plain English description to a focused map showing the gradients that we discussed earlier, to several charting tools. Now, I say charting tools because they are interactive and will provide you with even more details about this anomaly. Clicking on the chart will bring up an expanded version of it, but will also give you the ability to access the information behind it. In this case, hospital emergency department registrations. From there, you also have the ability to drill down into the details of each of these registrations. If you choose to collect other data sources, such as air and water quality, information on these would be displayed here, allowing you to compare trends in data sources to determine if one might be affecting another. As more latent data arrives, it will also be displayed here, helping you determine the severity of an event. All of these data visualization features are designed to help you better understand the detected anomaly and make a more informed decision on whether this is an event that needs to be investigated further. If you determine that further investigation is necessary, EpiCenter will help guide you through this process from start to finish. As an example, I will create an investigation based on this particular anomaly. From here you will see that you now have the ability to take actions, such as assign an investigator, maybe someone within or external to your group, and add notes and collaborate with others working on the same event. An action and feature that is unique to EpiCenter is the ability to group anomalies into a single investigation.
Okay, we've covered a lot of material in just a few minutes. As a recap, EpiCenter was designed to meet the demanding analytic needs of epidemiologists. With the ability to incorporate and analyze numerous data sources, correlate and display these data in an intuitive and informative way through a unified interface, and promote collaboration between groups, it is truly a breakthrough in health surveillance systems. This is Steve DeFrancesco from Health Monitoring Systems. Thank you for viewing our demonstration of EpiCenter. We look forward to talking to you about how your agency can integrate EpiCenter into its daily activities.